If I told you there's a single pill capable of significantly improving your erections, enhancing your urinary function, and promoting better prostate health, would you believe me? Stay with me until the end of this video, because I'm going to tell you exactly what this medication is, how it works, how you should take it, and what dosage is clinically recommended. This is a powerful, clinically proven solution that many men are still unaware of, but one that could transform the way you live, love, and age. I'm Dr. Fiona, a sexologist and urological surgeon, and today we're going to uncover the science behind a single medication that can elevate your vitality and restore your quality of life. So stay with me. This may be the most important health advice you hear this year. You know the good thing is? This medication that I'm going to reveal is both scientifically validated and clinically used to improve erectile function and alleviate urinary symptoms commonly associated with an enlarged prostate, also known as benign prostatic hyperplasia (BPH). You might be wondering, if such a medication exists, why isn't it more widely discussed? Why is it that this drug is often prescribed either for erectile dysfunction or for urinary symptoms, but rarely for both simultaneously? The answer lies partly in how the pharmaceutical industry markets medications, targeting different conditions separately, even when one drug can effectively address both. So, what is this medication? It's known as Tadalafil, a phosphodiesterase type 5 PDE5 inhibitor. Its primary mechanism is to enhance blood flow by relaxing the smooth muscles in blood vessels. When taken in lower daily doses, it improves the blood supply to the penis, allowing for more consistent and sustained erections over time. That's why it is also referred to as the daily pill for erectile dysfunction, because it is the only medication in its class PDE5 inhibitors that is approved for daily low-dose use, in addition to being used as needed. The low-dose daily version is what gives it the nickname the daily pill, because men can take it once every day, rather than timing the dose before sex like with Viagra sildenafil or Levitra vardenafil. This approach allows for spontaneity in sexual activity. You don't have to plan sex around a pill. You're always ready. You don't have to wait for the moment or plan hours in advance. With daily Tadalafil, you're always ready. This unique dosing method gives men something they value most in intimate relationships: spontaneity and confidence. No pressure, no ticking clock. But how does it work? Here's the science. You know, when a man becomes sexually aroused, the body releases a chemical called nitric oxide in the penile tissue. This triggers the production of cGMP, a molecule that relaxes the smooth muscles in the blood vessels of the penis, allowing them to widen and fill with blood. That process is what gives you an erection. But there's a problem. The enzyme PDE5 quickly breaks down cGMP, and that can make it hard to maintain or even achieve an erection in the first place. Tadalafil works by inhibiting PDE5. That means more cGMP stays in your system, blood vessels remain relaxed and open, and blood flow to the penis is stronger and more sustained. Now here's what sets daily Tadalafil apart from the rest. It has a very long half-life, about 17.5 hours, and its effects can last up to 36 hours. But when you take it in a small daily dose, typically 2.5 to 5 milligrams, it maintains a steady level in your bloodstream. That leads to consistently better erections, not just for a few hours, but every day. Over time, this improves your overall erectile function and even enhances blood flow long-term. Some research also shows it can improve endothelial function, the health of the inner lining of your blood vessels. Think of it like exercising your heart. This medication essentially keeps your sexual system active, so that when emotional or physical intimacy occurs, a kiss, a touch, or a moment of arousal, your body responds faster and more effectively. It's like keeping the engine running at an idle, ready to accelerate at any moment, but the benefits don't stop at sexual performance. Tadalafil also exerts a relaxing effect on the smooth muscles around the bladder and prostate. This means that men who suffer from lower urinary tract symptoms, such as waking up at night to urinate, experiencing a weak urine stream, or feeling that the bladder hasn't fully emptied, can see significant relief. And here's something many people don't realize. Traditional medications used to manage prostate issues, such as alpha blockers or 5-alpha reductase inhibitors, often come with sexual side effects. These may include reduced libido or difficulty achieving erections. Tadalafil, on the other hand, not only preserves sexual function but can actually improve it, so patients benefit both ways: better urinary flow and enhanced sexual health. Now, while Tadalafil can also be used on an as-needed basis, the focus of today's discussion is its daily use. Now, once again, as a urologist, I often prescribe this 5 mg daily dosage to patients who have overlapping concerns with both erectile function and urinary symptoms. But let me be absolutely clear: no medication should be started without a proper evaluation by a qualified urologist. Therefore, a personalized assessment is essential to ensure the most effective and safe treatment plan. I want to emphasize that this isn't some miracle pill or magical fix. It's a scientifically studied, evidence-based medication that is part of our standard arsenal in urology. In fact, for many of my patients, Tadalafil is just an amazing pill that simplifies treatment by addressing two major male health concerns at once, often reducing the need for multiple medications and minimizing potential drug interactions. Tadalafil is generally safe for long-term use, well-tolerated, and comes with minimal side effects, especially at the daily low dose. That's why more and more urologists around the world are recommending it as a first-line therapy for men with ongoing erectile dysfunction. If you're someone dealing with ED, talk to your doctor about whether daily Tadalafil is right for you, because it's a science-backed solution that could help restore your performance, your erections, and your confidence. Your health is your foundation, and every man deserves to feel strong, confident, and fully alive. If this information helped you, don't keep it to yourself. Like, subscribe, and share it with someone who might benefit. And remember, this isn't just about treating symptoms. It's about taking charge of your body, your relationships, and your future. So, yeah, that's it. Until next time, stay informed, stay healthy.